10 properties, expanding in multiple areas. And the crazy thing is that,
You turn the whole house into bedrooms and you rent by the room. Anything like that is going to be, successful.
Number one, the one we're talking about today is what, Kim?
Senior housing.
Traditional real estate investing is dead. Robert Kiyosaki and Ken McElroy think this is the solution.
The number one investment in real estate.
Be sure to watch until the end to uncover just how lucrative this housing solution can be.
Eviction. So what happens, let's say, all right, someone doesn't pay, or maybe they don't follow the house rules, they're causing problems. That must be a nightmare to evict people, especially in California. So why don't you kind of break down what your quote unquote eviction process would be?
yeah, we've never had to evict. The big difference is we utilize a license agreement, and it has been beefed up by California attorneys and reviewed multiple times, and it's a living and breathing document. So I do recommend that people in their state have a local attorney review it. But we've added a ton regarding our specific niche. So sober living specifically, staying clean and sober, all of that stuff. But we've never had to evict. So this gives them a conditional license to a bed. It is not a lease. So there's no tenant law that's even implied. It's very clear this is not a lease. And the one or two times I've ever had to call the police for help because somebody might have been, just too drunk or something to leave on their own. The police have taken a look at that and said, okay, it's not a lease. We'll get them out of there for trespassing. No issues. In California, that's like people say that's impossible. It's not impossible. Like this works.
Beautiful. Like very simple terms. I tell people, think of it like Airbnb or a hotel. It's not a lease. It's a completely different legal term. All you're doing is simply licensing space. That's
Exactly.
it.
Yeah.
Yeah. And we won't get into the nitty-gritty on that. We could spend hours and hours. We have done that before. So check out our legal section in the Gold Course if anybody does want to dive into that. So let's do a kind of just an update on where your business is at now. I think you said you were up to 10 properties.
Yeah, 10 properties, expanding in multiple areas. And the crazy thing is that in several states now, sober living homes are able to bill insurance, state health insurance. And so we found that in California specifically, we could sign up with our local health plans, which are kind of like Medi-Cal is our version of Medicaid. And they filed something called an 1115 waiver that allows Medicaid dollars in our state to be used for things outside of the traditional scope of healthcare. And so one of the things they found was uh, 5% of the populations are homeless, suffering from substance use disorder, or exiting jail or prison. But those members made up 50% of the cost. And so if they could help get them drug and alcohol treatment and get them housed, especially when exiting a treatment facility, a hospital, or jail or prison, then they could essentially cut down their cost by 40 to 50%. And they offer that to us as housing providers, um, to be able to be those folks that house them. Uh, what that's done for us has been quite shocking. It has tripled our revenue. So we used to charge anywhere from like $1,200 to $1,400 a month per person. We are getting $108 a day per person, over $3,200 per person. Uh, and we can have 9, 10, 11 people in a house. So you can see how you can do the math. It is work. You're doing medical billing. We've created some capacity and got some grants to be able to do that again without being a nonprofit. You can apply for grants with your state to do this work. But it's been an incredible opportunity for us, and we're expanding across the state of California right now.
So guys, the a lot of the material you see on our YouTube page, the vast majority of our students, the coaches, Andy, what we teach in the gold course is really just the foundational basics. Andy has chosen to just stick with that and scale that. Andrew, did you kind of start out just the basic, similar to
Yeah.
gold business model, just
Yep.
providing housing, outsourcing anything, not worrying about it, right?
Yeah. And I think that's the way to start. You have to cut your teeth doing the basics, right? But there comes a point where after you've done the work for a little bit, you can start to look for ways to increase your revenue, add additional support for your residents. And what we found was, we were doing a lot of this work already, but there was no way to get paid for it. And it was hard to add more staff to do care coordination and these other things. Well, now through the state health department, right, we have the ability to actually get paid to do the work we want to do to help our people even more. And it adds more revenue to our bottom line. So it's been a really cool win-win to be able to find additional ways to help our people.
I just did the quick math, and the revenue per property is bonkers.
It's insane. Yeah.
So with that, with those extra activities, staff, you want to kind of break down like what your team would be and what services that you're offering?
Yeah. So for us, like we've applied for grants, we've applied for state help with consultants. Like the state actually paid for consultants to help us
Nice.
understand how to do all this work and implement an electronic healthcare system, an EHR, all that stuff. But basically, we've hired on care coordinators, or what they call lead care managers. It's basically the center person who helps coordinate between um, psychiatrists and primary care doctors and uh, substance use disorder treatment, outpatient treatment, stuff like that. So like kind of one point of contact. And then we have like housing navigators to help people find permanent housing. We have something that we call recuperative care, which is it's medical respite. It helps people who are homeless safely discharged from the hospital. Hospitals have to actually hold on to people legally. It's a federal law. They can't get discharged from the ER or from a hospital bed to an unsafe location, but that's costing health plans literally thousands of dollars a day, $3,000 to $4,000 a day. They have 24/7, monitoring, nurses, food, all of that. Well, that's why they're paying us a really good amount, in that particular case, over $200 a day to house people coming out of hospital settings. And so we've, brought on a nurse practitioner to help oversee that. But it's kind of a part-time supervisory role. It's not like a full-time nurse practitioner. But it's been cool that the state literally is paying for these things so that we can better serve our residents. And it's allowed us to actually serve a much bigger population because the number of people under the Affordable Care Act who qualify is much higher than the number of people who just simply needed a sober living bed when we first started.
Want to learn more about the future real estate? Sign up for your free training material at www.grouphomeriches.com.